And that was a live feed from the Swiss Spirit's Alisa Hotel. It's a forum by the Ministry of Parliamentary Affairs on governance, engaging a number of governance institutions ahead of the 2020 elections. So we'll bring you more on what is happening there later in our bulletins. But now, the National Coordinator of the Coronavirus Response Program, Dr. Anarfi Asamoah-Baah, has told Parliament his team cannot predict when Ghana will reach coronavirus infection peak. The Ghana Health Service in May said Ghana had reached its peak, a claim that was fiercely challenged by many analysts, including the Center for Democratic Development, CDD, and that's the fellow Dr. Kwame Sedu-Sapong. But Dr. Anarfi Asamoah said for now, Ghana's infection peak cannot be predicted.
Given the trend, when do we think it will peak? And really the true answer is I don't know. This is a really tricky business, and it's very easy to misquote somebody. The trend is still going up, and it's very difficult to really say in a matter of, I need to be a pastor or prophet to be able to do that. The third question was related, are we still having challenges with PPE? And the answer is yes.
Now, on the issue concerning transparency in the fight against the virus, Dr. Asamoah-Baah assured the team will continue to be more transparent, especially with cases concerning people who die of COVID-19 and testing.
Testing. It means those who are sick, who are in the hospital, who need to be tested, have to wait, and it plugs the hospital up, and that's where sometimes people say that the hospitals are overwhelmed. So if you agree with us, I think the first testing has been done. Subsequent testing, let us go strictly according to either you are exposed to somebody or you have signs and symptoms. Likely you have a clinic here. Dr. Pambo and his people are there. Anytime you have a problem, just rush to the hospital. And if you have the signs and symptoms which fit into the definition of the case, you'll quickly be tested. And when you are tested and you are found to be positive, then all your contacts will also be tested. That should be the case, and that is how we are doing it. And this is the way that we are going.
And so that was Presidential Advice on Health, Dr. Insia Sari, talking about government's response team having to halt the decision to go on mass testing. And he spoke in Parliament when he went there to brief the House on measures taken so far, together with the leader of the COVID response team, Dr. Anarfi Asamoah-Baah, as you heard earlier. Now, Dr. Insia Sari also entreated MPs to be ambassadors to support the government's efforts by intensifying health education at the various constituencies and rural communities to win the fight. Let's bring you some more stories here on Newsdesk. She lost one eye to a cancerous tumor, retinoblastoma, when she was barely a year old. This tumor, which is spreading to the other eye, according to doctors, could have affected other parts of her body. Though the cancer was curable, the Dani family couldn't afford treatment and surgery to save the life of their little Maulom. But today, there's hope, and we'll tell you about that hope later after this break. Stay with us here on Newsdesk.